Hi, this is Dr. Stone. This video is our clinical process video, the treatment video that I mentioned in the first. This goes over how we investigate, how we examine you to identify the patterns, and this is more the physical examination process. It also goes over what is required of you in order to start to break those patterns and change the internal environment that is causing the stress and the symptoms that you're experiencing. At the end, as I mentioned, I do have a special offer for anyone who's interested in this process.
Okay, here we go. This is our treatment video. Remember, we have a special offer at the end for those who are intrigued and interested in being evaluated in this way and perhaps even be treated in this way. So let's start with the question, what would you do for endless energy, like from the moment you step out of bed to the moment you turn the lights out, you are full of energy. What would you do for deep sleep, where your brain just turns off, and when it's time to wake up, it just turns on? If you think about how this works in nature, animals don't, wake up groggy and like, it's a deer and a whatever, wolf, and the deer's like, give me a minute, I just hang on, I'm wiping eyes and things. No, it's on, and that is how in a clean environment where there isn't a pattern of stress and inflammation, that's how that works. What if there was this experience of normal weight loss, meaning if you went ahead and dieted and exercised, you lose fat, and of course if you eat bags of chips and McDonald's Big Macs, and you don't exercise, you gain weight. But when the thyroid is suppressed, when energy is suppressed, I see all the time people working so hard and yet not having the results. What would you do for normal sensation if you have pain or numbness or tingling? Normal sensation is you drop a hammer on your foot and it hurts. Otherwise, it does not. How about a clear mind, that focus, that sharp focus, that extended attention, that great memory and recall? Motivation and passion, we're starting to get some real energy into our brain and body at that point. How about normal repair, where your hair, your nails, your skin, look very good and healthy? And normal reproduction, lots of families are having problems with reproduction, but this also refers to internal reproduction, where your cells are turning over on a continuous basis, where your stomach lining is basically a brand new stomach lining every 6 days or something like that. So how could you have an ulcer that lasts a month or a year if your cells are repairing and reproducing with normal cells? And I contend that it's a pattern that you're in. So what would you do for that? Seriously, what would you do for that? And I'm going to go through what the treatment looks like and what it requires of you. And honestly, it requires a good direction. But as far as, the discipline and how hard it is and things like that, I don't think it's that hard. But you keep your eyes out and see if you could handle something like this. So we're going to go through the examination process, talk about applied kinesiology and treating the person, not the name. Stress and inflammation, we'll get back to that and touch on it. Look at the brain consequences, how we examine the brain and the body, and then look at the treatment, like a treatment plan for somebody, and then just kind of do a little recap. So enter a name is just a name. Diabetes is just a name. Hypothyroid is just a name. Neuropathy is just a name. And it's a name you get when, like for instance in diabetes, your lab value reaches blood sugar 126, fasting. Bang, you get the name. Or a group of symptoms, numbness, tingling, burning in your feet, slow reception of those nerves. You have neuropathy, okay? So why? What the heck does it all mean? And I contend that it is your stress and inflammation patterns. Your stress is a threat to survival, oxygen, glucose. Inflammation is your activated defense system, which is sort of this danger model. And if you think about how our country works, when the president says code red and we have a high level of risk of attack or something, it's very stressful, and it affects our ability to thrive and produce. And certainly, we do not think of reproduction, and that's how it works inside of our body too. So, when our defense system is on, you can't thrive. When your stress system is on, you can't thrive. You can't reproduce those cells. So, I guess the point there is that you gotta work on the top levels. You gotta handle the defense systems, and what causes those to be on. You have to handle the stress systems and what causes that to be on. Then you can handle thyroid and blood sugar, and then you can handle repair and improving digestion and things like that. Reading the signs is such a key concept. And it's such a different concept. We live in a symptom suppression culture. So how do we learn to read the signs? How do we learn to read the messages that are coming to us as symptoms? They're asking for something. What do you think the message means if your energy is low? If your feet are burning? What does that message tell you? And how might we better understand what a symptom means? And that is the art of the way we diagnose, which we'll talk about more. But if you look at how we're used to being diagnosed, and I use these, TSH greater than 5, I'd say, hey, something's going on with the thyroid. But if we just stop there and we say, you have a thyroid problem, and it's because your TSH is greater than 5, what does that tell you about you? Or if your blood sugar is over 126 or over 200 after you eat, and you get the name diabetes, and I agree with the names. I'm not saying don't use the names. I'm just saying, what does that tell you about you if you stop there? And I think the message we receive from our doctors is that this is what this means. You are broken. And what can you do about being broken? Basically, you can manage it and you can suppress the symptoms. And that's very contrary to trying to read the messages and answer them. And once again, does it work? When people get thyroid hormones, most of them who are on it still don't feel well. They still have high symptoms of that thyroid category. They still have lots of thyroid symptoms. So is it really even working if it lowers your TSH? That's not true health. So here's a graphic of just how these things overlay, and they really do work into each other. Stress creates inflammation. Inflammation creates stress, so it can just overwhelm your system. And sometimes I will see people who have high, over 50% scores on their symptom surveys in almost every category. Here's the few things that activate the inflammation system, the immune system. Certainly chemicals and things like that in our diet, high sugar diets, which also equates to nutrient lack. Stress, as I mentioned, causes inflammation over time. But here's the biggies: toxicities, that's your chemicals in your environment. And we have never had such a world like we have now, where we genetically modify our foods, hundreds of thousands of chemicals released into our environment. So there is a consideration there. People have been tested for pesticides, and everyone that they tested had it in their fat cells. Sensitivities, and as we get more and more stressed and more inflamed, we become more and more sensitive. We become sensitive to our environment, we become sensitive to our foods, we become sensitive to sugar. And then infections, those are things that activate the defense system. What activates stress? Pain, so that can be a snowball. You hurt, and that causes stress, and that causes more hurt. Anemia, where you're not getting oxygen. Blood sugar ups and downs, very stressful. And then, like I said, inflammation. And then the life effects, the relationships, the feeling of overwhelm. And we all have stress, obviously, but it's when it hits that certain threshold that it starts to change our internal environment. It starts to change our hormones, and then there's a cascade of different effects that we'll see, affecting steroid hormones and you name it. So here's our examination. The diagnosis that we're looking for is not a name. I mean, like I said, I agree with the names and I use the naming system, but what we want to diagnose is what can we improve. So as we look at the brain, the central regulator, if you go into our philosophy video, I'll talk a lot about the brain and how it functions as far as regulating towards survival. If we look at the back of the brain, called the cerebellum, it works with coordination, so we may do something like a finger-to-nose test. The frontal lobe, that's the very front of our brain, has to do with our personality, our focus, our attention, our passion, all those things. We look at things like fast eye movements, like if you're in a conversation with two people, you don't slowly track to the other person, you quickly jump to the other person, and those movements, the accuracy, the speed, the timing of those, is an indicator of how well your frontal lobe is working. The parietal lobes are your sensory part. That's all the feeling. So we will check, how are you feeling? And so often, in these inflammation patterns, we'll see that the sensation on the toes to vibration has been significantly impacted, even if it's not a neuropathy patient. And as we age, in the senior citizen population, the number one cause of death is actually falling. So the number one cause of falling is not having good coordination, not having good sensation in your feet. Slow eye movements, that slow tracking also is a function of the parietal lobe. So if you're having problems following my pen across a slow movement, we know we need to work on the parietal lobes. The brainstem is your vital functions, and we can look at things like behind your eye. You know how the ophthalmologist looks into your eye and they see the veins and the arteries? We can see that the veins are swollen and the artery is constricted under a stress process. That's what happens, and so this will be twice the size as this, and we'll see that swelling and constricting. And then we look at the ratio, and they should be the same. We look at pupil responses to light. Your nail beds, how are your toenails doing? Are they thick and white? And that's oxygen delivery. That's one measure of oxygen delivery, but we do the oxygen perfusion test also, which I'll do a little demo of so you can see it in action, but it's what a wonderful tool that is, and you can check the stress response instantly in the office every visit. And then we move from the labs testing into kinesiology, and I'll give a quick demo on that, or show a quick demo between this slide and the next.
Hi, this is Dr. Stone. I wanted to just talk about the basics of kinesiology. For many people, that's a different concept in terms of evaluating. The basics are, we're looking at patterns, and those patterns will manifest in your body. So, as I mentioned, if your shoulder is up and back, and you stand like this, in order for your body to move in any direction, there has to be a muscle that contracts and there has to be a muscle that relaxes. So if I move my arm up like this, my bicep has to increase in tone, my tricep has to relax. So to help identify what we can do to help you, we're going to look at what are the muscles in this particular case that bring your shoulder down and forward, which is this muscle right here. If that muscle is in fact weak, then we can use that as a monitor, as a objective assessment for what's going to work best for you. So let's say that your lab tests show that you're in a stress pattern. Cortisol is out of balance. Maybe certain minerals that go along with that are out of balance. And there's 50 different supplements that we could possibly give you for your adrenal gland function, for soothing your stress system. And this muscle is weak, so when we push on it, there's no resistance or limited resistance. Whereas this muscle, when we push, it holds very strong. So we may use a substance and put it on a point that in acupuncture relates to your adrenal glands, your stress glands. And if we get, in fact, a strengthening from putting that into that energy meridian, we're going to surmise that that's going to be one of the best things for you. And we may go through, this supplement not as good, this supplement not as good, this supplement, that seems to be the best. So rather than take a guess at what the best supplement for you is based on your labs, when there could be 50 such supplements, we're going to identify what neurologically and energetically works the best for you. I think that gives a huge advantage to achieving better results.
So let's look at the treatment. If the brain is not firing, is not electrified the way it's supposed to, you're going to have compromised regulation. So we do oxygen and we do activation. With the activation, do we want to do soothing activation, like visualizations, colored glasses or lenses or something soothing, or stimulating, something like movement, exercise, vibration that's kind of stimulating to your nervous system? And where do we want to do it? We want to do it on the right or the left? Do we want to work more on balance or more on feeling? But we're going to be stimulating the brain in most cases. And then we're going to look at the diet. Now, talking about what your requirements are, the number one thing that I ask of people is that they eat protein on a regular basis to baby the stress and blood sugar regulation systems, your adrenals and your pancreas. That means you carry some almonds with you or something like that, so you're having something maybe every 2 hours. That's the thing I ask most. Now, when we go into testing food sensitivities, there may be some adjustments to the diet in the short term. But as we soothe the stress systems, as we dampen the inflammation systems, you will become less sensitive to your foods. There might be one true allergen, like celiac. You probably can't go back to gluten if you really truly have celiac disease. Those are the two big changes. And of course, we have to avoid food chemicals, processed foods, and things like that. But we're going to work to a place where you don't have to be perfect too. We do need to move our bodies, and we do need to use precise clinical nutrition. This is basically my medicine right here, and we can affect every system. Some of the big things that we do with immune regulation, soothing the immune system, is a protein called glutathione. It's an amino acid that is manufactured in our body, and it is exhausted by stress overwhelm and inflammation overwhelm. It just depletes it out of our system. Almost every disease, that's true. Vitamin D also depleted by the stress and inflammation patterns. We need to remove antigens. That's the fancy word for something that's irritating your immune system. That's the infections, sensitivities, allergens, and toxins. So what's provoking your immune system. And then we can balance the immune system. So certain chemicals stimulate certain parts of our immune system. Virus stimulates or activates the B cells. Those are your antibody-producing immune cells. And there's certain substances like echinacea that stimulate T cells. And when you stimulate T cells, it actually inhibits B cells. So you can create balance in there. And I have a document, probably 50 pages long, that goes through hundreds of botanicals, which are plants, and what they do specifically in the immune system and how they shift it around. And if you compare that to what medicine offers to treat your immune system, like if you have autoimmune, the only thing they have is when your symptoms are so great, they do mild chemo, prednisone or something like that basically just squishes, it just blocks. There are plants for the stress physiology called adaptogens. Some you might have heard of. Ginseng is kind of famous, but there's a bunch of them. There's another plant, this is basically a nutrient called phosphatidylserine, so I shortened it there. If you've been searching for a while, you've probably heard of it because there's a great popularity of using it for stress process, and there is research showing that it will decrease over high cortisol patterns. But if your immune system is on and driving your stress physiology, you can take all the adaptogens in the world. You have to get the top priority first. And if we go back to the muscle testing and the kinesiology, we're basically asking your body what it needs most of all, and listening. We're answering by using that system of diagnosis. Inflammation, fish oils, enzymes. There's proteolytic enzymes that help clean out arteries. Lots of minerals are very helpful with relaxing muscles, getting inflammation. Botanicals like turmeric and ginger that are very anti-inflammatory, and we can shift inflammation markers that way. Condition specific, there's a plant called ashwagandha that has shown in clinical trials to increase T4. There's a special kind of thiamine that has been shown to regenerate nerves in neuropathy. Gymnema, another plant that has been shown to regenerate pancreas cells. Just amazing things that these things can do and get down into the repair process. So sometimes we just got to give the raw materials, the proteins, the vitamins, the minerals, the enzymes that your body runs on and repairs on and reproduces on. So we get you on a protocol, and it's obviously not going to be everything you see here. We'll pick out, the top priorities. So we need a little bit of this, and we need, a botanical for immune balancing, and we need another to soothe your immune system. And then we eat protein for 4 days. You come in and do some oxygen and get some treatment on your body to decrease stress using the meridian system, the Chinese acupuncture system, to help regulate your body. 4 weeks later, we retest your labs, just the labs that were abnormal. So if there was a stress, that was cortisol that was high, now we retest it. How did we do? Mostly, we do really well. Sometimes we're like, we need to make some serious adjustments here. Or reconsider the whole process, or look deeper at, take another lab test that looks at something else to see. We adjust accordingly and keep moving. That's how you move forward. That's how you have progress. So that's what it looks like. Taking a few supplements, moving your body, getting some oxygen activation, a couple little changes in your diet perhaps, and by hitting the top priorities and moving through your system and asking what it needs and responding to those needs, we can shift labs and we can shift your health. And that's really how it works. And I've seen some amazing things happen with people who have been at their wits' end and through the ringer with doctors and natural doctors and alternative doctors, and with this system we've been able to break those patterns. So here's the offer that I was going to talk about, and this is just sort of an incentive to take some action. And like I said, this is 48 hours from the time you sign up for this. We will honor this. Otherwise, you can always come in. If you are kind of an analyzer like I am, and you need to think things over, that's our normal fee right there. But what this includes is your initial examination. So that's visit 1 and visit 2 here. So there's no additional charge for you to come in. Now, when you come in, we are going to treat you. We're going to give you a treatment, but we're also going to talk about the timeline, and we're going to talk about what tests are going to be important to monitor your progress, and we'll talk about, of course, the costs of that. But there's no additional charge for that particular visit. If I'll lay it out, and I take kind of some pride in having an end to my treatment protocol or my treatment plan. So I'll timeline it, and I think that's unique to what we do. If you are put on diabetes medicine, that's basically the rest of your life. That's the treatment plan. That's the timeline. You stay on this forever. So while I'm not contending we can cure every condition, or to achieve your goals, and we talk about what your goals are. I want increased energy. I will set out a timeline and what we need to see change based on what I've seen in the past. So you need to sign up for that and call Sammy, like I said, within 48 hours, and the cost then will be $75. You mention that to her, and she'll know what you're talking about. The rules of engagement, we just have to agree to these rules. You need to be willing to change, which means you follow my recommendations. There's more than one trail up the mountain, of course, and I know my trail. So if you want to take a different trail, if you want to follow different recommendations, go for it, But I want people to be following my recommendations so that I can take full responsibility for your course of care. You got to be willing to grow. That means looking at yourself, your beliefs, your relationships, the rules, and all those things. And just be curious, kind of an ignorant curiosity, like, well, that came up. Interesting. Let me check in on that. So there's got to be that willingness. And then to be disciplined. It's not always easy to change. There may be some, dietary changes, like I said. You come back and you're very sensitive because you've been in a pattern for a long time. And a handful of foods that are very common foods are reacting in your system, and it's going to take a little discipline to avoid that while we heal up the gut, heal up your immune system to get you back onto a normal track there. But if that sounds like you, I really look forward to partnering with you on achieving your goals. And if you do choose to come in, if you go to our website, you can get all the paperwork there, and we want your story, your paperwork ahead of time, and whatever labs that you can provide us as well. I want to be reading that and coming into my exam room with you well prepared. So if you have any questions, of course, this is my little guy, Gates. You can email me at this email or give us a call and talk to Sammy. She does all the administrative stuff. Insurance and whatnot, and you can ask me any technical questions. I'd be happy to talk to you also. We may need to set up a time to talk, but I thank you for your time, and I hope you enjoyed.